Hi, I'm Dr. Cheryl Wilson at Living Well with Dr. Wilson, 26K Avenue in Barrie. And I have a passion for sports injuries, and I've had that for years, following with my career prior to being a doctor when I was a certified athletic therapist or sports therapist. I've worked with professional ice hockey team. I've worked at the varsity level at the University of Mount Allison, and I've worked at various events like the Canada Winter Games and a couple of years ago at the Commonwealth Games. I am a proud sports doctor member of Sports Medicine Australia, as well as I've received the certification in musculoskeletal medicine from the Australian Association of Musculoskeletal Medicine. So I've taken extra training to really understand what's involved in sports injuries. So often people are asking, what is the difference between the average rehab and someone who's an athlete? And there's a world of difference between getting someone back active in a game versus back to sitting at a desk and doing some desk work. And this is where you need someone who's got experience in someone who's an athlete and how to get them back safely, quickly, back into the game. And that looks in a variety of things. One is a sport specific. What exactly is a sport and what is your position in the sport? What position you are on the field or the court will mean different certain movements that the person that's getting the person back into the game needs to be aware of. There is also aspects such as the volume of force that goes through the injured area. That involves the intensity, how hard someone's going, the duration, how long you're doing it for, as well as the frequency, so how often you're doing it in the week. And when you look at that volume of force, and that needs to be pulled back and then gradually increased to get someone back in the game. And there is a world of difference between getting someone back in the game in one part of the season where we're starting with the practices and then back into the game versus someone who might be right in the middle of playoffs where they might want to hold back on the practices so that they are as fit as possible for the game. And each individual gets to decide what their goals are and are supported to achieve those in the safest, swiftest way as you can. The other aspect is sports psychology, not dealing with the natural grief of not being able to play and having aspirations that might not be able to be achieved right away, that might have to wait until next year. The other aspect is that we're now aware that if you are sitting on the side of the court of the field and you put in your mind's eye that you're on the field playing the position you normally are, you are lighting up that part of the brain and the nerves that go to the muscles and keep that engaged and ready to go. We often see this in the Olympics when the divers at the bottom are moving their arms and thinking around. You can see them going through the dive before and they're perfecting it again and again. And it's an important aspect of staying mentally and physically fit. That's another aspect. How can we maintain the fitness optimally while protecting that injury while it's healing? And that's going to be specific to the sport as well as the individual and their age, as well as what specifically is injured. We'll look at the range of motion, getting the full movement back, functional strength, not just strength, functional strength for the sport, and something called proprioception, which is balance. We need to have the balance so we have that awareness in space to protect the joint that had been injured, and this is a crucial aspect that needs to never be missed so that we decrease the likelihood of having another injury in that area. So often the people that say I keep spraining the same ankle have not taken the time to do the balancing proprioceptive exercises to regain that awareness in space to protect them. Then there's other things that are really unique. Work with a volleyball team that had ACL injuries. Then what I did in the off season is I worked with all of them to strengthen up a muscle stabilizer on the side of their pelvis called gluteus medius. And when they functionally strengthened that, we didn't have any ACL injuries the next year. So there's a lot to sports injuries that is beyond basic average rehab and is so important to keep you healthy, happy, and back in the game.